I am now pleased to welcome our panel discussion, Living with Vasculitis, Mental Health, Education, and Next Steps. Our panelists are Dr. Vidya Sivaraman, who is a pediatric rheumatology and associate professor of clinical pediatrics at The Ohio State University Nationwide Children's Hospital in Columbus, Ohio. Also joining us is Dr. Camille Wilson, who is a psychologist with Big Lots Behavioral Health Department of Psychology at Nationwide's Children's Hospital, and Dr. Chloe Freeman, who is a psychologist at the Big Lots Behavioral Department of Psychology at Nationwide Children's Hospital in Columbus. I want to thank all three of you for spending your afternoon with us, and I will turn the floor over to you. Thank you.
Sure. Hi, everybody. Let me go ahead and share my screen and then we'll get started. But first, thank you for having all of us here today. It's really exciting to have you all be part of, have you be part of today's Education Day. And let me just...
Oh, and I just want to say we're running a little bit past schedule, but that's fine. Please take your time. These are great presentations, so please take your time.
Thank you. Yeah, I think we'll be doing okay here. Okay. So let me just flip this. Is this showing correctly for you guys now?
Yes.
All right, excellent. So we're going to be talking about living with vasculitis. We'll be touching on topics related to mental health, education, and next steps. And then we are the three presenters. I'll actually let each of us kind of introduce ourselves. But we'll be talking again about mental health, education, and then we'll have a third component about getting ready for next steps. And we'll open up a time for the Q&A, and you guys can feel free to drop a question in the chat, and we'll try to answer them as we're going or during the actual Q&A portion. So I'm going to turn things over to Dr. Freeman so that she can start talking about mental health considerations in vasculitis.
Thank you, Camille. As Camille was saying, I'm Dr. Freeman. I am one of the pediatric psychology fellows at Nationwide Children's Hospital. And so I'm going to start us off today with the mental health component, just specifically focusing on emotional and mental health and ways that families can offer support and promote positive coping. So my plan today is to review just common reactions in mental and behavioral health concerns, discuss a little bit about cognitive behavioral therapy, talk a lot about parent strategies to promote coping, and then some effective coping skills as well. So just to jump right in, some of the most common reactions in mental health and behavioral concerns are these 6 that I have listed here. We often hear a lot about stress and anxiety, not only for the patient, but then also for the family. When there's a new diagnosis, or even for families who have known about a diagnosis for a while, things kind of change throughout their course of treatment. So we're often seeing stress and anxiety. On the positive end of that, we also see a lot of resilience as well. The kids kind of keep going. They often surprise me with how resilient they are. And so some children do really cope really well, and families cope really well with the changes that come as well. And then there's always a period of adjustment with every developmental stage that these kids are going through and the families are walking with them through these journeys. When you add the medical component onto it, a lot of things are adjusting all the time. And so there is a lot of adjustment that seems to be just ongoing. And then families often talk about behavioral changes. So kids may become more oppositional. They may become a little bit more defiant. There may pop up and be like behavioral changes at school. So we talk a lot about that. And then also with that is the mood changes. So you may see that after a new diagnosis or a new change in medical treatment, even just changes, as they're continuing to grow, their mood changes. They may isolate a little bit more. They might want a little bit more comfort. They may be a little bit more aggressive. They may just appear to be more like a worrier. And so those are some of the mood things that we'll talk about later on as well. And then finally, I think a big one for a lot of our patients are the social and the peer components that come on. So to have a chronic medical condition, sometimes we hear our families and patients talk a lot about the social aspect of it, of just they feel different, they feel like they don't fit in, they're worrying about how do I explain what I'm going through to my friends, or how do I explain just having restricted activity, having to do things modified. And so these are just some of the most common ones that we see and that we talk about. And so we'll talk through some strategies to help with these 6 most common reactions and concerns as we go on. So this next part, we're going to talk specifically about parenting strategies. As we were talking about like just promoting positive coping, one of the things that I think that we talk a lot about in psychology is cognitive behavioral therapy, which is one of the most common like treatment modalities in behavioral health. And what cognitive behavioral therapy, you may hear people use the acronym of CBT. It really identifies the links between thoughts and feelings and behaviors. And so what we know in behavioral health and psychology is that promoting healthy emotional functioning, it positively impacts success in other areas. And so when I talk with patients, I always talk about like the 4 domains of functioning. So the social domain, the academic domain, the physical domain, but then also the emotional domain. And so as we go through like treatment of cognitive behavioral therapy, we're often talking about more problem-focused coping. We're working on improving self-talk, changing negative thoughts and just identifying some of those negative thoughts, focusing more on improving their functioning and even improving behavior, and then focusing more on their values and goals. And so in a course of cognitive behavioral treatment, we're talking a lot about behavioral management, coping, adjustment, all of the mood concerns that can come up. And so always just kind of hitting at it from every component listed here, the thoughts, the feelings, and the behaviors. And so we're going to talk through some strategies for parents to kind of hit on some of these as well. So the 5 most, I think, I don't want to say most important, but the 5 that always come to my mind when I'm thinking about promoting positive coping is empathic listening. I think just being a good listener is at the core of just us communicating with one another. And we'll go into that one a little bit deeper on the next slide, but just talking more about just active listening and what does active listening look like? What does it sound like? Emotional awareness. I am often talking with families and with patients, and we're talking about a lot of things that are either really exciting or things that are really frustrating, and we're having a hard time labeling or putting an emotion to it. And so I talk a lot with parents about just giving the vocabulary to patients to be able to express what they're feeling. With that is open communication. And so I often say, sometimes they don't want us to start problem solving it with us. Sometimes they just want to come to us and they want to talk about what they're feeling. If they're starting a new medication and they're worried about, the side effects of it, like just being open and there to talk about it, not to talk them out of their feelings, but just there to listen. And then just continuing to maintain expectations. We don't want our patients or our kids to get into the sick role of everything they can't do because they have a new diagnosis or they have this chronic diagnosis. We want to continue to maintain expectations and then also continue to encourage functioning. And so functioning back to those 4 domains that I mentioned earlier, the social functioning, the academic functioning, the physical functioning, and also emotional functioning. So starting with empathic listening and emotional awareness, as I was saying earlier, just a really big focus on active listening. And so just as well as we want to be able to respond to them, we also want to be good listeners. And so often I'm talking about, making sure you're paying attention to your nonverbal communication. If you're active listening, you're giving them eye contact, you have your body is focused towards them, you're not fiddling with your phone, you're just dead on kind of listening to what they're saying. And then repeating and labeling emotions. And sometimes it's just you're summarizing exactly what they just said. I guess sometimes they'll come in, they're talking about everything that kind of went on that day, or, everything that's been frustrating. And, you might just say, sounds like you're feeling kind of frustrated right now. And they're like, yeah, like that's what it is. It's frustrated, but able to give them the vocabulary, able to label it for them. I think that's always helpful in the long run because later on they might have another day that's pretty similar to that, but now they may actually be able to name it. And then for empathy versus sympathy, I have a video. I'm going to see if I can share my screen with you so you can see the video. And hopefully you'll be able to hear it as well. Let's see. Can you see it? Okay. Now the trick is, can you hear it?
So what is empathy and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Hopefully you all enjoyed that video. I like that video because I think it puts us in a really good place of, there is often a time when our children are coming to us and they do feel some type of way about, oh, well, I wasn't able to go to school today. And it's like, but at least you made it here. And it's like, okay, but that's not helpful to hear a lot of the time. And so as I think about, just empathically listening, as Brene Brown was saying, like most of the time, all they really need is connection. They need somebody to kind of feel with them, take the perspective of what they could be going through and, and how much is changing all at once. And so just communicating more with empathy versus the sympathy. And then continuing on with empathic listening and emotional awareness, I often have parents kind of model this for the child in my office, or we'll kind of play around with this in clinic sometimes. And so it always starts with, you labeling your emotions and you expressing your emotions, because I think that's helpful a lot for our children and for our patients to also see, like, we're human as well, and we get worried and we get anxious. And one of the examples that we usually are using, if there's a new diagnosis, or maybe they've had a diagnosis for a while, but they're going to be meeting a new provider. A parent might say, I am feeling really worried and really anxious about, meeting your new doctor tomorrow. I'm wondering how you feel about it. And so you've labeled and expressed your emotions, and you've also asked your child about their emotions. And they may say, well, yeah, like I also feel kind of worried because, like, what if we forget to tell the doctor all of my history? And instead of being like, oh, no, we would never do that, like, we'd always get it right. We discuss those emotions without judgment, like, oh, yeah, like, I can see why both of us feel anxious, or why both of us feel worried. We want to make sure that we're telling them everything about you. We want to make sure that they have, like, the full picture of you. And so, just discussing those emotions without any judgment, and then going into collaborative problem solving. So I'm wondering, like, what can you and I do? Because it sounds like we're both kind of worried about the same thing. We're worried about meeting this new doctor tomorrow. We're worried about making sure they know all of your medical information. Like, do you think it would be helpful if we kind of wrote down the things we wanted to make sure that we talked about so that we don't forget? And either together or separately, you all may write down the things that you want to make sure that you're asking, or the things that you want to make sure that you're mentioning. And so I think going through the whole kind of like list of, actively listening, being able to reflect back what they're feeling, labeling your emotion, but then also labeling their emotion, asking more about how they're feeling, discussing their emotions openly with open communication, allowing them to express without any fear of judgment, and then going into problem solving. Like, all of this is kind of a good continuing to get them into just more positive coping. And then you don't leave home with those same anxious, worries and, oh my God, all these fears that you're going to forget something, because you've already made a problem. You've already problem solved and already reached a solution. And so getting into even more just coping and problem solving, when we do problem solving, we are often, we're getting together and like, okay, what can I do? What could be helpful? But then I often like to give families something that they can do at home, in the car, and just kind of on the go. So we're often talking about coping and relaxation skills. And so when I talk about belly breathing, I often have patients put like one hand on their chest and one hand on their belly. And I ask them, okay, as you're breathing, like, which hand is moving? And most often it's their top hand that's moving. And so then we start practicing. We talk about pets. Everybody has a dog. And they're like, oh, well, my dog breathes like this. And we talk about like, balloon breathing. And so we practice belly breathing in the office, and it's just really good for getting into more of a habit of good, like, relaxed breathing. And we talk about how good deep breathing is just really helpful for relaxation and calming the body and calming the mind, and, kind of getting us out of those anxious worries. From there, we talk a lot about guided imagery. And I often give parents just like a script of, you just direct them, sit back and close your eyes, take 2 or 3 just really deep breaths. And then I want you to think about like a place that you really love, a place that, you've been there before. Maybe you haven't been there before. You get full creative control. You can make it up. And, once you have that place, then I want you to think about, what you can see, what you can hear, what you can taste, what you can smell, what you can, see. And we go through all 5 senses. And that's also very relaxing and calming. And I usually have them practice in an office, because then if you already have a scene, the next time that you get anxious or you get worried, or it's before a doctor's appointment, or you're waiting on the doctor to come in, you kind of know, okay, well, the last time I did guided imagery, I went to the beach. And so patient and parent can practice that imagery relaxation exercise in the doctor's office. 5, 4, 3, 2, 1 is just about almost the exact same thing. It's also mindfulness, it's grounding, it's calming and relaxing. And it's thinking of, again, using your 5 senses, and you can do them in any order. What are 5 things you can see? What are 4 things you can touch or feel? What are 3 things you can smell? 2 things you can taste? And what's 1 thing you can hear? And in any order. And kids usually get really into it, and it's helpful. And I often tell them, it's also a distraction, because if you come in and you're like, oh my God, like this happened yesterday and this happened, and they're like, I gotta take this new medicine, then I'm worried about the side effects for this. And we're like, okay, well, let's just take a couple deep breaths, and then let's practice 5, 4, 3, 2, 1. It just kind of gets them out of that like very anxious train of thought. And a lot of people often like to listen to music. That's really helpful for coping and relaxation, as well as going for a walk. And then any other just coping and relaxation skills or exercises or activities that yourself and your child like to do, I think would also be helpful in those moments where you're just looking for something to just calm the body and calm the mind. And then getting into managing expectations and promoting functioning. And so again, as I said earlier, we don't want our patients or our children to get into like the sick role. And so we know that with everything that's changing in like their physical health and medically, we want to be able to still allow there to be structure and routine at home, because that allows for some predictability. And that's helpful for us to have that structure and routine, as well as expectations. These expectations are going to help them to be able to foster confidence in themselves, but then also be able to foster independence. And it also shows your confidence in them to be able to give them a responsibility or have expectations for them. And then to continue to encourage them to engage socially and academically, and also physically. All of those activities also promote positive mood and positive coping. And so it goes back to those 4 domains I mentioned at the very beginning. If they're continuing to engage and are continuing to function socially, they're going to continue to function academically, they continue to function physically, and then that 4th domain of emotional function, that 4th domain is also increased. And so they're also doing well and functioning emotionally well. And so I know at Nationwide, or just at every hospital really. Psychology is kind of embedded in different ways. At Nationwide, we're in a lot of the medical clinics, and even in the Department of Psychology, we specialize very, 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 very narrowly. One of the things that we have, because we're in so many clinics, our providers are often able to just refer directly to us. But when I'm talking to people who are at different hospitals or in different states and cities, one of my first recommendations is if your hospital has a department of psychology or behavioral health, sometimes your mental health providers may be embedded through like specialty clinics, anesthesia for pain, or just any other department. I think it's just really getting to the core of where those providers are in your hospital and trying to locate them that way, and asking about placing a self-referral if another provider needs to place a referral. Also contacting your insurance provider. That's usually one of my first recommendations, just because then you know exactly who's in contract with you, you know what the referral process is, if there is a referral process, and then they can also tell you all about your mental health benefits. And then always asking like a medical provider, whether it's a rheumatologist or a pediatrician, a social worker that you've worked with, what are their recommendations, or if they have any referrals for community providers or somebody at their hospital that they'd recommend you to. And then one of the last ones is just psychologytoday.com. A lot of the teams really love this one because they can see the provider's pictures and everybody likes to see who they're going to be meeting before they meet them. And so Psychology Today is one where you can search your city and state. If you know someone's name, you can look up their name, but you can read the provider's bio, you can read their treatment modalities, you can read if they work with children, if they work with adults, if they offer a sliding scale, what insurance providers, what insurance companies they accept. And also I think a big one right now is we're still, dealing with the pandemic, if they're doing hybrid sessions, so they're meeting people in person and they're doing telehealth, if they're telehealth only, or if they're in person only, because we all have a preference. And so I think that that's just a really good resource to have, to just kind of, look through what's in your area and who may be available to you. And I think that may have been my last one.
Yeah, thank you, Dr. Freeman. That was a great overview of just mental health care and some great strategies for parents to kind of help support their loved ones. There was a question in the chat about what if mental health issues are compounded by a separate issue, like giving the example of autism or Asperger's. Dr. Freeman, I don't know if you want to talk about like what the picture looks like when we're thinking about a chronic medical condition on top of other comorbid diagnoses.
Yeah, I think what in my experience, I think this could be different in many places. Here at Nationwide, I work very closely with a lot of the providers who are over our Child Development Center. And so we're often collaborating a lot on like if there's something they've already been working on, like what I can carry over and be helpful with in clinic. And it's such an individual, like case by case thing of what patients and what families need. I think it kind of like depends on like the issue. If it's like needle phobia, if we're helping with something with that, if we're helping with pill swallowing, if we're just helping with, communicating needs and feelings in clinic, we use a lot of different charts. We often have like Child Life come in. And so I would love to like talk a little bit more like specifically on that one, maybe towards the end, to see if like I can get like a definite example, to see if I can like provide a much like more narrow and direct answer for you. But I know we just work a lot like collaboratively and, just multidisciplinary as a team to make sure that we're hitting it from all angles to make sure that patients and families feel successful.
Yeah, and that's exactly what I was thinking was, I think each individual is unique in terms of their areas of need, whether it be medically, mental health wise, socially, and those pieces. And so I think the more that you can communicate with your providers and really bring in a team approach, bringing in the folks who have expertise in those areas to kind of mix them together to create that really tailored plan that meets the needs of your loved one. So I'm going to switch gears a little bit and talk about living with vasculitis just in an educational context. So as mentioned earlier, my name is Camille Wilson. I'm a pediatric neuropsychologist at Nationwide Children's Hospital here in Columbus, Ohio, and I do cognitive assessments of kids with chronic medical conditions. And so we'll be talking about some of why someone might want to come to get an evaluation, but also what to do when there are needs identified. So the plan of of where I'm going to be talking through with you all today is just to talk about chronic medical conditions and learning as a whole. What are some common school concerns that families may notice for their loved one? What is the special education process like? What does it look like? And what are some supports that schools can offer? And then we'll end my time with talking about just some specific strategies that parents and carers can use to help address those concerns that come up and to build that collaborative relationship, kind of that team relationship that I was talking about at the beginning. So what we know from the CDC is that about 20% of school-age children have a chronic health condition that can include things like asthma, diabetes, but it also includes folks like you who have family members that have been diagnosed with a type of vasculitis. And what we know from the research is that students with chronic health conditions have a higher risk of lower grade achievement, having more difficulty with learning academic material. They may have a higher rate of absence from school, whether it's because they're sick or for doctor's appointments or for other reasons. We also see that there are higher dropout rates in our chronic health population, and that sometimes there are more behavioral concerns, whether it be mood, anxiety, or acting out behaviors. Just one specific example within central nervous system vasculitis in children, we do see higher rates of learning difficulties, a harder time for children to remember information, and that they sometimes process information in slower ways. There is other research that's been done in Kawasaki's looking at attention difficulties and some other fields, but like Dr. Bloom talked about at the beginning, the research in terms of learning and cognition there's not a lot out there. And so there's a lot to be learned for these conditions and how these types of disorders can affect not only the body, but also the brain. So what are some common school concerns that a family member may notice? And so these are the three big areas. Dr. Freeman talked about kind of those 4 domains, and I kind of think about them, in 3, but they sort of encapsulate the similar areas. So we can think about it from academic, medical, and social. From the academic side, common school concerns a family member may notice is their loved one is having difficulty performing in school. Maybe they're really frustrated with the work and they're having a hard time finishing the work or keeping up with their peers, that maybe it's taking a lot longer to do something. And maybe you suspect that there's a learning problem or a learning disability that could be related to their medical condition. Or you might be concerned that school's not able to meet your child's learning needs. From a medical standpoint, you might be concerned that your child's medical diagnosis or physical status is impacting their learning, their grades, or even just their ability to go to school. That maybe school doesn't really understand the impact of that diagnosis and the symptoms that may be related to it. Maybe your child is having some side effects or symptoms that make it hard to be at school all day or to manage the demands of different aspects of the school day. And then also when we have folks who are in the hospital, maybe for a disease flare or a different episode, how to help their child get back into a school routine after an episode like that. Socially, Dr. Freeman talked a little bit about this too in terms of the mood and behavioral adjustments and things that might be happening, but your child may be experiencing teasing and bullying. They may have difficulty keeping or making or keeping friends. There may be medication side effects that make your child more self-conscious around their peers. Maybe with those steroid treatments, they're experiencing a weight gain or, their body looks a little bit different than they're used to. And so that might make them more hesitant to be around their friends or be at school. Or maybe teachers and other students don't understand why your child has to miss school so often to go to the doctor's office and things like that. So if there is a problem that's identified, particularly around the learning or emotion coping, then you as a parent or caregiver can identify that problem and can formally request an evaluation to the school. And so then that request usually is submitted in writing to school saying, we are seeing this need for my child based on this, maybe new diagnosis, or we're noticing this new area of difficulty. The school then has about 30 days to respond to that request and plan an evaluation. And so that evaluation can include things like formal testing with a school psychologist. It can include classroom observations. It can include parent and teacher ratings and so on. And just really trying to get a good indication of kind of where a child is functioning and how maybe these different things are impacting their learning and engagement in school. Once the evaluation is completed, then the results are reviewed by the school staff, but then they also bring together a large meeting, including the family, including teachers, including the school administrators, and then they create a plan. And that process usually takes about 90 days to complete. And so based on the results of that evaluation, a school may determine that a student may meet criteria for additional supports. And so there's two different routes, main routes that can go in terms of formal school supports. A student may meet criteria for a Section 504 plan, and that is under the Rehabilitation Act of 1973, or they may meet criteria for an individualized education program, or what we call an IEP, and that's under the Individuals with Disabilities Education Act, or IDEA. So let's talk about what these two are. They're a little bit different from each other. Basically, if we start with an IEP recognizes that a student has a disability that affects their learning or academic performance. And in the United States, there are 13 categories that have been set by federal law and state standards under which a student can meet criteria for a disability. For those of our audience who are from outside of the United States, it may look a little bit different with your educational system. And so if a child is determined to meet criteria for a formal disability, then that is usually through the results of a multi-factored evaluation, or an MFE. And so then a school can then set into place a series of supports for a child in the classroom setting. Maybe they're setting up additional therapies like physical therapy, occupational therapy, or speech therapy. A Section 504 plan looks a little bit different in that it recognizes that there is the presence of a physical or mental impairment or history of impairment that does limit a major life activity. And these are some of the ones that are listed there. And that can be documented by medical or mental health records. You don't need a formal testing for that. That can usually be documented, with a doctor's note or other records. And a 504 plan often provides more accommodations. So these are more behavioral strategies that teachers can use to help support a student. So it might be check-ins, redirection, reminders, and prompts versus an IEP where they may be actually changing the curriculum and how it's taught to meet the needs of the learner. All right. So as you are navigating the process of learning needs for your loved one, here are just some tips of what a parent or carer can do. I think the biggest thing is to be talking with your child's teachers. Find out, how are things going? What are areas that they're seeing your child doing really well? What are areas that they see where your child may be struggling? And to see if that matches with what you're noticing at home, because sometimes things can line up, but sometimes they can look a little bit different, and it's really good to have some conversations with your child's teachers to figure out what they're seeing so that you can try to figure out what's going on. If you do see learning concerns or other emotional or other concerns that you think may warrant a formal evaluation, definitely reach out to the school and request an evaluation to see if they would meet eligibility for special education services. And so if your child already has some formal supports, you can request a meeting with your child's team at any time to problem solve. You don't have to wait until your annual meeting. I think the other thing, in terms of talking with your child's teachers, is to share information about your child's medical condition, about the care plan, or maybe even just some general websites to help educate your child's teachers about your loved one's diagnosis. I think sometimes folks don't necessarily understand what those diagnoses are, or how it can impact day-to-day functioning, or even maybe some of the medical treatments, and what the side effects could be, or even how much time it may require someone to be out of school. There are also some really good local advocacy resources that may be available to you. There may be like parent mentor networks that you can loop into. I know here in Ohio, we have a pretty strong parent mentor group that helps support families move through the special education process. There are also more formal routes you can go, like hiring an educational advocate or talking with other folks within the school district. So just some tips for when you're communicating with schools, when you are concerned that your child may be struggling, I think it can be a really tough place to find yourself. It can be frustrating, it can be stressful. And so I would really recommend first to take a team approach. You are a very important part of your child's team. Your medical provider can be someone that you can bring in to help provide education. I just saw that there was a question about maybe having some materials about diagnosis and information and the support plan. And so I know Dr. Sivaraman had mentioned like talking to the doctor about getting a letter written that describes the diagnosis or the needs for accommodations. And so that can be a really important part of bringing in the team, but also to view the school as a team. And it can be hard to do when you're feeling frustrated, you're stressed, you're watching your child be distressed. So we just encourage families to assume the best, that remember that schools are sometimes they're stressed and under-resourced. And so they may be struggling on their end. And so we just encourage families to keep calm, but to continue being an advocate, and you can do that in really powerful ways, like maybe just asking questions for the school, like what do they see? What can they do to help? Are there things that you can do at home to help support your child? Or are there other community supports that the school could recommend that could be helpful for your child? But I think the big thing is to remember that you are an expert about your child. And you are the one who can really provide some really important information about your child's needs, their learning or communication style. You can even share with the school and teachers about what works for you guys at home, like what are strategies that you have found helpful. And then I think the other thing is your child is getting older and maybe approaching middle school, high school, maybe even going on to college, is to help bring in your child to then be their own advocate and giving them a voice in being able to talk about what's helpful for them and what they need to help them be a learner. All right, and so then here are just some general resources to read more about the special education programs that are available. So there's some basic guides here, and then, several folks have mentioned the Vasculitis Foundation website. I think it's got some nice resources and even just some video testimonials from families talking about navigating school needs and transition points and things like that. So those will be available for you. And then I think we'll switch over to Dr. Sivaraman to start talking about getting ready for those next steps.
All right, perfect. Yeah, I think our chat is now getting a little more active, which is nice to see. All right, again, so I'm Dr. Sivaraman at Nationwide Children's in Columbus, Ohio. I will say huge thank you to Dr. Freeman and Dr. Wilson for their expertise. I will say we're extremely fortunate and thankful every day that we have psychologists and neuropsychologists embedded within our rheumatology clinic. They're embedded within our rheumatology clinic. That is pretty much unheard of, I think, across the country, probably across the world. And so we're really able to help our patients at that level because this is just a huge part of dealing with a chronic illness and dealing with a rare disease. So we're really thankful for their expertise. So I'll just talk really briefly. I know we're over time, but just talk really briefly about next steps. So basically, something that we all as pediatricians deal with is that the children, the young babies and young kids we take care of are going to grow up one day and go from childhood to adulthood. I know as a parent, it's not easy as I see my kids get older and get ready for college and get ready for adulting. It's something I have to adjust with every day at home. And I'm sure you all as caregivers see that too. So the differences here, I'll just kind of highlight, Okay, so basically the big differences here, I'll just highlight, are in the situation where it's a child, you as a parent or a caregiver are really the big decision maker. So you're the one primarily in whose hands the situation has been when your children are younger, to be able to be that decision maker, be able to do all of this research, come to a conference like this, learn about the disease, learn about the treatment, and advocate for your child. But then what happens when they become an adult? They're basically going to be looked upon to have more independence and be able to make some of those decisions, which we refer to as self-management. So that's a really important term that we've come to use in this field. And the term transition is a very broad term, but the word transition, in many cases, people assume, oh, you can go to the next slide. Sorry, I forgot you were advancing. A lot of times when we say the word transition, people think of it as meaning the actual transfer of care. So here, as you see in a passing a baton, you're actually like transferring the care to the next person. And what you saw on the previous slide was really that it's a process. But the transfer is really that end result where the child's care is actually handed over from a pediatric rheumatologist to an adult rheumatologist, or what we sometimes call an adult model of care. So that's the end result of it. So I want you all to kind of take a step back. If your doctor or anyone around you has mentioned that word transition, it doesn't mean the transfer. The transfer is just the end result. So don't panic. You're hopefully not there yet, and hopefully you have some time to prepare. So you can go to the next slide. So some of the big differences I'll just kind of highlight here. This is, so a lot of these slides were actually from our division chief, Dr. Stacy Arduin. This is from her publication in the pediatric clinics, which we basically have for all pediatricians to read, because the pediatric model is very different from the adult model of care. We're fortunate Dr. Arduin is actually trained in medicine and pediatrics. So she's actually an adult and pediatric rheumatologist. And there are extremely few of those. If you saw how few pediatric rheumatologists there are, the number of adult and pediatric trained rheumatologists is probably less than 20 in total around the country. So this is really, they're in the single digit and very precious resource. So in the pediatric model, we base it more on the family. It's more nurturing. The parents are involved. It's a lot more developmentally centered and much more interdisciplinary. On the other hand, the adult model of care is very different. It's tends to be more individual focused. Not necessarily, but in general, can be more cognitive. We expect the patient to be pretty much an autonomous agent to be able to make their decisions. And in many cases, it's disease-centered. Fortunately, we do have multidisciplinary clinics for some diseases, and so that can be a huge resource. And that was one of the things I think that Joyce was referring to in terms of the vasculitis centers, because if they're multidisciplinary, that's gold for you to be able to help you out. Okay, go to the next slide, please. So there's a lot of cultural differences you'll see. The one on the left is our beautiful children's hospital. We call this the Magic Forest, where it's really welcoming and there's a lot of little animal friends and very welcoming, colorful atmosphere. On the right is our adult hospital, which is the Ohio State University Wexner Medical Center. Does tend to look, it looks nice and modern, but it does tend to feel a lot more impersonal. When you go to the next slide. So families, a lot of you might be feeling like this, right? So we talked about how our diseases are multi-system. Well, this is another diagram just showing you, oh my gosh, am I going to look at their medical needs, their developmental needs, their school or social needs? Where am I going to begin? So this can feel like a huge task at hand, but do not fear, you're not alone, and it doesn't have to happen overnight. So you can go to the next. So there are some barriers that we, do encounter, and patients do tell us about this. So some of those really important barriers to think about as you prepare or work towards this journey. Definitely insurance issues are something that we have to take into consideration. Family and patient beliefs and expectations. What are their relationships? What is their knowledge and what are their skills? Where are they in terms of their brain development? Because that is another huge factor, just like you mentioned, if there was a child with a cognitive issue, even before their diagnosis of vasculitis, that could definitely be an important point. Non-adherence to treatment, I won't go into detail, but does tend to be a big issue as our patients tend to get, as they get older into their teenage years and feel that they don't really need to know why they need their medicine and that they're really doing well. And there's definitely different approaches that you're going to see. You can go to the next slide. So again, why do we need to talk about this, right? So definitely there's that adulting behavior, they're slowly getting more independent, starting from that little baby and toddler. And then we basically go, they're getting older, getting more independent. And then there is that change in the role of the primary care provider. And one thing that I will highlight as a pediatrician is that there are adult health concerns that we as pediatricians often do not feel comfortable taking care of. And so we get to the point where we do feel like we're ready to hand them over to somebody with more expertise in other adult healthy behaviors and health concerns. You can go to the next slide. So again, I will not go into this in much detail. Some good resources. So this website is an amazing resource. It is gottransition.org, developed by Dr. Patience White, who happens to also be a rheumatologist. It has a toolkit that you can basically download different components. It has components for the physicians, components for the families, and components for researchers and policymakers. It kind of has a stepwise approach. I won't go into it in detail, but definitely look into that if you have a child that is coming closer to this age. You can go to the next slide. You can go to the next one. I should also mention before I go to the next couple slides is that the American Academy of Pediatrics does recommend starting to talk about transition starting at age 14. Now, while that might sound really young, that's the recommended age to even start thinking about some of those self-management behaviors. So if you have one of those younger, teenage children, and I think that's why we had our breakout rooms structured that way, is because that's the age group you actually want them to start learning about their disease, why they're taking their medications, and so on. All right, so in the next couple slides, I will just quickly highlight some more special consideration for young adults with rare diseases. So here you are now, you actually have not just a chronic disease, you also have a rare disease. So it adds another layer of complexity. What I will say as a person with a strong passion in rare diseases is that most rare diseases are diagnosed in children. So you'll see from this graph that the majority are diagnosed within the childhood years. And then there's a slight peak that's in the adult years. Because many of these diseases, some of them have a genetic basis, but many of these diseases are conditions that seem to be diagnosed in young children, in children. You can go to the next slide. So what are some questions that you might want to ask? And many of you might already be going through this, right? So you have a young adult with a rare disease. Will the adult providers know about my condition? Do I have to get together a whole new team? Do I have to change all my providers at the same time? How will things be different at the new clinic or hospital? Will the adult provider want to change all my treatments if they're working for me? If the treatment's already working for me? So you can see how these questions might definitely come up in your mind, but don't worry, you don't have to have all the answers at the same time, and you do not have to change all your providers at the same time. So we will often go piecemeal if a patient is ready to transition some of their doctors to adult care, we kind of move it along slowly. So it's definitely a process. It doesn't happen overnight. Just as you might say that the day somebody turns 18, they're legally considered an adult, but it's not as though we consider them an adult that we won't see them anymore. You can go to the next slide. So the transition with rare diseases, as we've highlighted from a lot of what we've talked about today, that planning becomes even more important. So I cannot emphasize that enough. There is a fair amount of planning that goes into it. We as the pediatric providers are happy to work with and help your adult providers to make that process as smooth as possible. You can go to the next slide. And I will just have a couple of resources that I can share. There is an app for that. So there are several medical apps. You might find some if you have an iPhone. There's a medical or health app that is on everybody's phone. You can already start putting in medical information as far as the diagnosis, medications, and things like that to just start keeping track of different health concerns. You can go to the next slide. There's also resources available for Android. And there's also emergency medical apps that are available. You can go to the next one. So also other useful apps that I like to tell my patients about, there are some that help you to take medication. So as your child is getting ready to go off to college, this would be a very useful thing to actually have an alert that's set up on your phone or whatever device you use. So there's one that's like a pill reminder for iOS and Android. I have one I like personally that was actually recommended by our pharmacist that she tells our teenage patients about. It's called Mango Health, and it basically tracks their medication adherence. And it's nice for teenagers, for kids and teenagers, because they actually earn points from it. So it kind of makes it into a game, makes it kind of fun, and sends them a reminder every day to make sure they take their medication. There's also calendar apps that you can use for reminders, especially for appointments. So that's one that I do tell my young adult patients to make sure they start keeping some sort of calendar, just so they know when their school schedule is. And if we're taking care of patients out of state, they know when they're home on break so that they can schedule their appointments. There's also student planner apps that you can look into. And then the next one. That may be all I had. Okay, so actually that was all I had. I know that was a ton of information between the three of us, but I think each of these is kind of broken down into a separate component. It may seem overwhelming, but I think talking to your child's doctor will definitely start that process. And so it is a team effort, as you can see.
Thank you so much, Dr. Sivaraman. Can I ask, how did the department get placed within the rheumatology group? Was that a special grant, or, I mean, it's brilliant.
Well, that's what I know Dr. Freeman referred to it, but I think I'm not sure, but as an institution, it started where we have a psychologist basically embedded in different clinics. So we have a huge behavioral health support team at our hospital. So we're very fortunate for that. Not all children's hospitals have that kind of resource. So actually, the last time we had a presentation like this, our regular psychologist, Dr. Lever, had presented, and our division chair actually got multiple emails from other division chairs saying, how can we get funding to get one in our clinic? So yeah, and I will say the background, a little more background of that is, as I mentioned, vasculitis is one of those multi-system diseases where we have to work with so many specialists. And lupus is the other big disease that we take care of that has a lot of similar challenges. So what we have is we've basically built, it's a lupus and vasculitis clinic. And it's through that clinic, it's in that clinic that we have the psychologists available. So that's where we're kind of able to we actually have our nephrologist there, we have a lung doctor there, we have a pharmacist who's able to help with medications, a social worker. So everybody's in that clinic, and that clinic is held twice a month. So, and a lot of those vasculitis centers that you mentioned, they have the same model of care in adults, because in adults, they have a lot more patients that they're taking care of. And so they're able to do those. So that's that term, the multidisciplinary clinic. So if that's something that's available in your area, that's certainly something to look into.
Yes, I think that's a great point. And the American College of Rheumatology has a great Find a Doctor locator app on their website. We have a Find a Doctor on the VF website, and we also kind of maintain an informal list of physicians and offices around the country and internationally. So, okay, so I'm going to make an executive decision that we're going to skip the break. You all just had a great break. You just don't remember it. But to keep moving forward, and just thank you all three for making time today to be on this. It was a brilliant discussion. Thank you so much, and we look forward to doing more with you.